Hello, everybody. So good morning, good afternoon, good evening, whatever time that you all plan to listen to this lecture. This week's lecture is going to cover a lot. You're going to see that we're going to cover last week and this week in the lecture. And I know that you have a lot of chapters to read to go along with this, and that a lot of last week's assignment and this week's kind of really overlap. So we're going to go through all of it together within this one lecture. So it's a lot of information. It's a lot of important information for you moving forward as a traditional clinical practicing clinician, as well as a leader and a manager. So please understand that we want you to have that information for documentation and reimbursement. You do have a treatment planning and documentation course at the end of the curriculum, but documentation has been woven into a lot of your classes. And it continues in this class, and making sure that you understand effective documentation to ensure reimbursement, and effective documentation to understand how to communicate with other practitioners and the importance of that. So please take some time to understand effective documentation and its relationship to the OTPF, and its relationship to advocating for this profession. So one important thing to remember, again, I know it's a lot of information, but a key quote to remember is, if it's not documented, it didn't happen. You're going to hear me say it often. You will probably hear Dr. White say it often, and anybody else who is teaching you an intervention course. If it's not documented, it did not happen, and you will not be reimbursed for it. Your organization will not be reimbursed for it. This lecture will focus on ACODE standards B429, 5.4 and 7.1, just a little bit on that 7.1. So federal and state laws directly impact reimbursement and documentation. Reimbursement is directly impacted by the services and the products that we can provide to our clients. And remember that clients can be a person, a group, or a population. To make sure that you really understand that and remember that, go to the OTPF. I believe Table 1 defines the difference between clients in those three groups. And then there's also a table that really goes in depth into occupational therapy interventions. And that's one of your longer tables within the OTPF. So make sure that you understand our scope of practice, what we can do and what is not in our scope. And there is a document, an AOTA official document on scope of practice. You also have within your state and jurisdiction the regulations that guide occupational therapy interventions and occupational therapy services, and that will also go into the scope of practice that is allowed with your specific state, your specific jurisdiction. So make sure that you go through the questions on page 273 and make sure that you can answer each question on page 273, because those are really going to help you to make sure that you understand this content and you can make it through these learning objectives. So last week in groups, you created context to educate somebody on 3 different reimbursement systems. And now is the opportunity to review the posts of your peers. So as you see here, the assignment was to do your initial post, and I did not make it mandatory for you to respond to peers, but if their information is wrong, it is your duty to put in an oppositional statement or to give evidence that supports why they are wrong or why you believe they are wrong. Did you take the time to answer additional questions to make sure that you understand? So looking at the review questions in the practical applications in OT related to triple aim, and those are on page 455, number 3. And I specifically point out number 3 because it's vitally important. So as we look at understanding triple aim and then quadruple aim, which is the new system, that initial triple aim really looks at improving the experience that our patients have, looking at improving population health as a whole, and then reducing per capita cost for the population. So that triple aim hits those 3. Make sure that you understand the quadruple aim now, because we are now in the stages of quadruple aim. AOTA has a phenomenal article about how occupational therapy is one of the only healthcare providers that addresses all three aspects of the triple aim and really has a role in reducing hospital readmission. So if we're reducing hospital readmission, then we are absolutely improving population health and reducing per capita costs. And that quadruple aim information is on page 282 of your required textbook. So last week you had the pleasure of having Frank Gaynor. Frank Gaynor is absolutely a friend of the Trinity program. He's a friend of OTs everywhere. His name is well known, and when he said please come up to him and speak, he absolutely wants you to come up to him and speak. He is a very personable person, and is a great asset to introduce you and network with other OTs in the world. So Frank is a great resource. So using the information in your textbook, all the AOTA official documents, and all the information that you learned from your state and regulatory board, additional questions to look at and to make sure that you can answer are on page 593 and 594. A lot of those ethical issues that Frank touched upon, you will go a lot deeper, and with these questions on these pages, you'll go a lot deeper with Dr. Talisman in OTM 630 next semester in your ethics, policy, and advocacy course. So moving on really to last week's assignments, I'm sure that you at least skimmed the tables and looked at chapters 29 through 31. Although this textbook is the most up-to-date, it was not here during the COVID-19 pandemic. So this one came out and was published actually in 2019. So I really want to give you some information on how some reimbursement things changed as a result of the COVID-19 pandemic. So on March 13th, 2020, President Donald Trump issued a proclamation, which was Proclamation 9994, declaring a national emergency related to SARS-CoV-2. On March 27th, 2020, he issued an Executive Order 13911, delegating additional authority under the Defense Production Act with respect to health and medical resources to respond to the spread of COVID-19. This changed the game for everything. This changed the game for everything in relation to licensure, how we take the exam, when you can take the exam, where you can take the exam. It changed the game related to service delivery, reimbursement, and documentation. Please note that this federal proclamation is a federal proclamation. The federal proclamation was extended by President Joe Biden in February 2022 and holds true until the national emergency is resolved. So again, please note that this is a national order, not a state-based order. The initial proclamation and executive order opened doors for occupational therapists in home health and telehealth, absolutely things that we had been on Capitol Hill advocating for well before the COVID-19 pandemic. An example is an oasis in home health. Occupational therapy practitioners cannot be the sole providers of services in home health, nor could we open a case using an oasis form. When COVID-19 occurred and the COVID-19 pandemic occurred, again, the game changed. We were on the Hill prior to the COVID-19 pandemic, asking, requesting, and begging for the opportunity to go in and open cases and being a single service provider in home health. We can now do that. We can now do that. That was a huge step. Secondary was the reimbursement for telehealth services. Again, a game changer. COVID-19 if it did nothing else, it validated the need for and the ability to provide telehealth services. It showed that we can be effective in a virtual space. Again, if you go to the OTPF and we talk about virtual environments, we treat patients to improve virtual environments. We take virtual context into consideration, but we did not have the opportunity to be reimbursed for telehealth services in most settings. The COVID-19 pandemic opens the door to that as well. AOTA has some phenomenal resources on understanding home health and telehealth and how OTs have an impact in both of those practice settings in both of those areas. So telehealth is still considered an emerging practice area for OTs, and some aspects of home health are as well. So some states and jurisdictions, though, have ended their emergency order. So it's important that you understand what that means. So, for example, in DC ended the emergency order. Therefore, to practice as an OT in DC now, you must have a DC license. During the COVID-19 pandemic, it was opened up to anybody who had an active license. You could practice in DC with that active license under the emergency order. Now that the emergency order has been rescinded, you can no longer do that. You must have a DC license, an active DC license. It's also important when you understand Medicare and Medicaid. Medicare is a federal program, 100% federal program. Medicaid is a state and federal program. So you need to understand what that means in relationship to service delivery and reimbursement within that. Although it's all under the umbrella of CMS, Medicare and Medicaid are very, very different. So take the time to look at page 4. It's 459, so 459 for the specific differences of the two, as well as table 4.2. I love a table, so I'm always going to kind of point you to the tables to get some better information. Okay, so now with all of that information and all of that you've had in all of these chapters from 28 to 48, 63, and all of the tables that you've had, how does reimbursement really work? And does anyone really read your documentation? Let me let you know, yes, they do. People are really reading your documentation. And it really matters. Again, let me go back to the point of, if you don't document it, it didn't happen. But with those questions, those are both very loaded questions. So how does reimbursement fully work? Reimbursement depends on the services being provided, where the services are being provided, so the setting that those services that the services occur, and the payer source or payer sources. So make sure that you understand that. To answer the question in its most basic form, note the word reimbursement. It's reimbursement. Except for a possible copay that may be happening here or there, our services are paid for after they are delivered. So that's an initial evaluation, and that is any type of reevaluation, and that is any actual interventions that occur. So let's move to the second question. Does anyone really read your notes? Yes, absolutely yes, they read your notes. As stated at the beginning, if it's not documented, it does not happen. And what you document matters. We've moved to electronic medical records, thankfully. Some of us like it, some of us don't. It was a hard switch to go to the electronic medical records from documenting everything on paper, but I promise you we much so like it much better. It is important that you understand HIPAA and exactly what are the letters that go with HIPAA. Please do not ever tell somebody that HIPAA is HIPPA. It is HIPAA. Know what those letters stand for. Understand ease of access. Understand security and accountability of access. Understand portability. So it's Health Information Portability and Accountability Act. So understand what that means. As a practitioner, it is important to understand and uphold the laws related to HIPAA. Again, your written or electronic medical records, your electronic documentation matter. Make sure you are crystal clear on your organization's documentation, policies, and procedures. Whenever you onboard to a facility, it is important that you understand how do they document, what do they use to document, and how it impacts reimbursement at that organization. Making sure that you follow the laws that guide your license, as well as the laws of your state and the national laws related to the payer source. Please take time to answer the questions at the end of all of the chapters. There are a lot of multiple choice questions, and all of those answers, again, are at the end of the book. So to make sure that you are crystal clear and to check your learning and to check your understanding, make sure that you take the time to do that and answer those questions at the end of the chapters. So going forward, we move closer to your business plan. Next week, we have a Zoom session on the 28th at 7 o'clock. That will be with me. This is your opportunity to ask broad stroke questions related to the business plan. We're moving towards your market research, your SWOT analysis. What is your overall strategic plan and business plan look like? What is the vision that you have? Most of you have shared your vision with me. Now it's time to put that vision into real action. So what is that going to look like? Is it real? As you're doing your market analysis, some of your business plans may change. So take the time, as you see here, to meet with me if you need to, so that we can make those changes with your business plan and I can go ahead and approve them if needed. I will see y'all in Zoom next week.